Measles is a disease many health professionals thought we had licked. But with an outbreak in Texas that has killed one unvaccinated child, Indiana healthcare systems are on alert. Tonight, WRTV's Rachael Wilkerson shares how you can protect yourself.
As cases of measles pop up in neighboring states and across the country, health officials are concerned about the possible spread. I spoke to a local doctor about how you can check to see if you're immune.
The average person who has measles will infect 18 other people.
Dr. Shannon Dillon with Riley Children's Health says measles is highly contagious and will stay airborne for 2 hours. So far this year, Kentucky, New Jersey, Texas, and New Mexico have reported cases.
At least 124 confirmed cases of measles associated with this outbreak that's going on in West Texas and eastern New Mexico at this point. And that's already half as many cases as we saw of measles in the U.S. in all of 2024.
Dr. Dillon says the current vaccine for most kids is the MMR vaccine, measles, mumps, and rubella.
And typically in most kids, we do a dose at age 1 and a dose at age 4.
But there has been a decline in vaccinations across the board, reducing herd immunity. Dr. Dillon strongly recommends vaccinating children and says adults should check their own records. She says you should consider a booster or vaccine against measles if you don't know when or if you've had the shot. You were vaccinated before 1968 because back then the vaccine was less effective. And even if you were vaccinated before 1989, when only 1 dose of the current vaccine was required.
We think that people born before 1957 largely have what we call natural immunity and don't need to worry about getting boosted because measles infection generally provides lifelong immunity after you've had it.
Dr. Dillon says you can even ask your doctor for a blood test to see if you have immunity against measles. Rachael Wilkerson, WRTV.
And the symptoms of measles include a high persistent fever, a bright red rash, a rash that will start at your head and spread to your feet, goopy eye discharge and pink eye, and a cough. If you have these symptoms, doctors want you to call ahead before visiting a clinic instead of just walking in.